All right, we'll go ahead and get started. Welcome everyone to our webinar this evening. All right, let's get this going here. Okay, so tonight we'll be going through FEHB and health insurance basics. Um, Throughout the presentation tonight, you'll see some QR codes. You can scan that at any time and create your account on our platform uh, at um, at goparco.com. And you can book an appointment to talk to us at any time that you'd like. Also, on that platform is a really holistic financial and retirement planning experience purposely built for federal employees. So feel free to scan that at any time throughout the presentation tonight to get a lot of the stuff we're talking about today, plus a whole lot more tailored to your situation. So I do see a lot of new folks on the presentation tonight. I think part of it's because of the nature of the topic we'll be covering. But our company's Parco. It stands for Pension Americans Retirement Company, and we help people from across the country and around the world plan their retirement, especially if they work for the federal government. And we work with folks no matter what stage of their career that they're in. It could be folks who are just starting out and just beginning with the government. Obviously, folks who are in the middle of their careers and want to make sure they're taking advantage of all the opportunities available as a government employee. And then folks nearing the end of their careers, trying to make sure they're taking full advantage of what they need to before they retire to put themselves in the best position for that next chapter in their life. So we work with folks no matter what stage of their career, what stage of their life they're in. We even work with a lot of retired folks as well. And our goal really is to take a lot of the complexity and confusion and uncertainty that can come with things like planning for your healthcare, your TSP, your FEGLI, your investments, your life insurance, all these different things, mortgages, debt planning, pension calculations, all this stuff, all these things that work together, taking all that messiness and making it really simple, clear, and focused. So tonight we're going to be going through a couple things. We're going to be going through some health insurance basics. So we'll talk about what health insurance is. As open season is upon us here, we thought it was really important to kind of go through some of the basics there. And then we'll talk about FEHB. Then we'll talk about Medicare. We'll talk about how Medicare and FEHB work together. We'll go through some FAQs or some frequently asked questions. And then we'll go ahead and get started. Now, I saw a comment on here that my audio is coming in kind of echoey. Is anybody else experiencing that before we keep going? Okay. Well, if you are, just chat and I can try to reset stuff. Okay, cool. All right. With that, let's go ahead and begin. So let's start off by talking about some basics regarding health insurance. So in the United States, most folks get their insurance from their employer. And a little bit of background about this. This is some of you may be wondering also like why is this the case? You've never even maybe thought about why your employer provides you health insurance. Well, it came about during the Great Depression. There were price controls actually on wages, and a way that companies got around those wage price controls was to offer benefits. And one of the first benefits they offered was employer sponsored health insurance. So that's kind of like where that comes from. And now, the largest group of people where they get their health insurance from is from their employer. There's also a cohort of folks that get it from the VA that are in the military. And then there's people that have private non-group coverage. Then there's a chunk of folks that are uninsured. And then there's a large portion of the population that are covered under Medicare and Medicaid. So when it comes to FEHB for our federal employees, that's your employer sponsored health insurance. Um, That's your employer sponsored health insurance. So what does that mean? Well, generally, no matter where you work, I mean, the folks that work with us here at Parco, your employer's paying a portion of the premiums, and then so are you. So you have to contribute a portion of the premium, and then your employer will pick up some amount. One of the biggest benefits of working for the government is how much of that premium the government picks up. So we're going to be talking about a few different um, concepts tonight. And I wanted to make sure went through a couple definitions so you guys understood exactly what we're talking about. And for some of you, this may be the first time you've heard or seen these laid out explicitly. So the premium, when people talk about your health insurance premiums, that's the amount that you're paying each month to have access to health insurance. So if you're enrolled in DHA or Blue Cross Blue Shield or Aetna or United Healthcare, whoever you're enrolled in, and you have a amount coming out of your paycheck every pay period, that's your premium that you're paying for your health insurance. That gives you access to the health insurance. Then there's your deductible. So the deductible is the amount that you must pay out of pocket each year before your insurance company begins to pick up and pay for covered services. This is not your premium. And we'll walk through a couple examples throughout the presentation, but that's what the deductible is. Then there's your copay. So your copays are fixed fees for specific services. And this could be for doctor's visits, for prescriptions, things like this. These count toward your deductible. So if you have a $30 per month prescription for something, so that's 360 bucks a year, that $360 per year is subtracted from your deductible. So once your total out of pocket reaches your deductible, you're no longer required to pay any more money toward your health insurance and toward your health care. Co-insurance is kind of similar to a copay. It's the extent of a cost that you share for a certain coverage. So once you've met your deductible, whatever that number is, you might be required to pay 20% co-insurance toward a procedure. So once you've met your deductible, an amount above that, but below your out-of-pocket max is what's called your co-insurance. Your out-of-pocket max is the maximum amount that you can pay. Okay, we're really breaking up. All right, give me 1 second. Okay, give me 1 second. Is this any better? I've turned the video off to maybe make the uh, buffering better. Good, worse, good. Okay, cool. So next is your out-of-pocket maximum. Oh, it's funny that that's actually how it works. So this is the total amount that you'll pay in a year, including your co-pays, deductibles, and co-insurance. After reaching this limit, your insurer covers the rest. So it plateaus or maxes out at that out-of-pocket maximum. The network is the group of doctors and hospitals that your provider has contracted with to insure. Using in-network providers is usually a lot less expensive than out-of-network ones. So when people are talking about the network that you're in, that's what that's talking about. Covered services are the medical services and treatments that your health insurance plan covers. And this usually is the preventative care, hospitalizations, prescriptions, maternity care, mental health services, sort of like the normal things that you would need for healthcare. But then there's sometimes things that are excluded. And this can vary by plan, but this is things like maybe a cosmetic or an elective procedure or something experimental that the insurance company doesn't want to cover. And then separately, prescription drug coverage, the insurers break prescription drugs out as a separate thing from normal services. So usually those fall under like a separate portion of your health insurance plan. And then there's sometimes provider access rules. So this would be the requirements by your health insurer for what you have to follow to get care. So sometimes it'll be you have to stay in a certain network, or you have to see certain physicians, or maybe you have to get a physician to refer somebody to you before you can go see that referral or that specialist. Maybe you also need pre-authorization for certain procedures. And that can vary plan to plan and provider by provider. So let's take an example of how this health insurance works. So let's say that you're enrolled in Blue Cross Blue Shield Basic, which is the self plan, and you're paying $133.77 per pay period, which is what the new premium is going to be for this plan going into 2026. So a couple key details about this plan. There's no deductible, which is really nice. So there's no deductible. Your primary care copay is $35. Tier 1 prescriptions cost $15. Tier 2 prescriptions take 35% co-insurance. You have an inpatient copay of $200. You have a hospital inpatient copay. So this is, let's say you go get a surgery of $450, and your out-of-pocket maximum is $7,500. So let's say you just have a normal year where you go to the primary care physician 3 times. You have two monthly subscriptions. Those will cost you $15 in copays per month. So your total out of pocket during that year is $465 for care. On top of that, given the premium amount, you're paying $3,478 per year in premiums. So your total health insurance, or I'm sorry, your total healthcare costs for a normal year is $3,943 in this example. So just shy of $4,000. Normal year. Premiums plus the out of pocket that you have to pay. Then let's say one year you have to get back surgery. And that back surgery is going to cost $24,000 because you're going to be in the hospital for a night. You're going to have a doctor there for the night. Like, that's what it's going to cost. So maybe in preparation for that, you have to go see the doctor 5 times instead of 3 times. And you've got the same two prescriptions, but then you also have an additional prescription because of the back surgery. And let's say that's an expensive prescription. Let's say that that costs like $600 a month on as the quoted price. Well, the insurer is going to pay 65% of that, but you've got to pay 35. So that's a $2,520 prescription. Then you have to pay a $200 copay for the procedure as well as the inpatient costs of $450. So your total out of pocket during that time, during the year you had the back surgery, is $4,245. But then you're going to get billed for the back surgery too, and that's going to true up to your out of pocket maximum to get you up to it by charging you an extra $3,255. So you'll have hit your out of pocket maximum of $7,500 plus you'll have paid $3,478 in premiums, the same as the previous example, for a total healthcare cost for that year of just shy of $11,000. So hopefully that's kind of like a helpful, it's obviously a simplistic breakdown of kind of how these things work together and what these different terms mean. So, we mentioned an FEHB plan. We mentioned the Blue Cross Blue Shield basic plan, but what is FEHB? So, FEHB is a benefit available to you as a federal employee, just like your FEGLI, just like federal dental and vision, long-term care, all these different your pension, all these different benefits that are available to you as a federal employee. Your federal employee health benefits, your FEHB is your health care, your health insurance. And it's really one of the most valuable benefits that you have as a federal employee, and then again as a retiree. There are multiple different providers of FEHB, places like United Healthcare, Blue Cross Blue Shield, GIHA, Aetna, Cigna, all these different companies and many more are part of the FEHB program. And these companies have contracted with FEHB to offer health insurance plans to the 3+ million folks that work for the government, plus 3+ million more who are retired from the federal government. So it's actually a very, very large health insurance plan. And so one of the reasons why we say this is one of the most valuable benefits that you have is how much the government pays toward your health insurance premium. So the government pays 70% of the price of your health insurance. So the premium that you're paying every pay period, or if you're retired every month, is 30% of what that health insurance costs. The rest is being picked up by the government. This is extremely generous. And that health insurance subsidy persists into retirement. That is unheard of. It's unbelievably valuable. Now, it's like the costs of many things. The premiums can and do increase each year. So in 2024, premiums increased over 13%. For this upcoming year, going into 2026, so actually, I'm sorry, going into 2025 from 2024, premiums increased over 13%. This year, they're going up about 12% on average across the board. So that's something to be prepared for and aware of. Now, we get this question all the time because federal employees will ask, like, what about this thing called Medicare? How does this work? Now, look, this is not a Medicare presentation. We could go into detail on Medicare for days, but we wanted to cover some of the main highlights. So, Medicare has four main parts. The first is Part A. This covers hospitalizations. It's a mandatory deduction that comes out of your paycheck. So when you see a Medicare deduction coming out of your paycheck, this is actually paying for Medicare Part A. If you've been contributing to it for 40 quarters or 10 years, it's free when you turn 65. And this covers hospitalizations, home health care, and hospice. That's Medicare Part A. Um, we always recommend folks pick it up when they turn 65. There is no reason to not turn on Medicare Part A when you turn 65. Next is Medicare Part B. So this is kind of what's called general Medicare. It is optional, though we'll walk through reasons why federal employees in particular tend to elect it in retirement. The the premiums for this year, upcoming year, are going to be $206.50 per month. And this covers outpatient, doctor visits, durable medical equipment, things like that. Next is Medicare Part C or Medicare Advantage. I imagine many of you have gotten phone calls about Medicare Advantage plans. Generally, for federal employees, um, you don't need to be worried about Medicare Advantage or even consider it. These are Medicare Part C or Medicare Advantage are basically private insurance alternatives to Medicare's Part A, B, and D. So it's basically like a creating its own health insurance in place of, but compliant with Medicare's requirements. Most federal employees and retirees don't need to worry about Medicare Part C. And then Medicare Part D covers drugs. The cost can vary by plan. Um, all FEHB plans are required to be Medicare Part D compliant. So again, most federal employees, we say this all the time at Parco, that federal employees and retirees are different. The retirement planning that you guys have to do is just different than how it is for most Americans. This is a big reason why is that healthcare planning and health insurance planning for you all is more dynamic and actually far less stressful because you have access to FEHB in retirement. So you don't even have to worry about this Medicare Part D stuff either. So people ask us all the time, like, what will Medicare cover? What will Medicare not cover? We always like to highlight a couple of things that they won't cover that might surprise people. So things like hearing aids, visits to your getting an annual physical, routine foot care, dental care, overseas care. These are things that Medicare does not cover. And then there's this idea of assignment. So assignment is the doctor and the provider's agreement to accept Medicare approved payment for service. So when you're seeing a doctor, especially after you're 65 and you're on Medicare, knowing that your doctor is participates or accepts Medicare is a really important thing, or the provider that you're going to is a really important thing before you um, do business with them or go see them, because if they're not part of Medicare, then they're not going to be covered. They're not part of that network. So let's talk about how FEHB and Medicare work together. So when you have FEHB in retirement, Medicare becomes your basically primary payer, and FEHB becomes your secondary payer. And this is how those interact. And we'll walk through an example here. We always recommend that you read the material inside of your plan documents, just especially if you have specific medical issues, to figure out what your plan does or won't do with or without Medicare, especially given you might have some specific health issues. Um, this is particularly important for something like a lot of the FEHB plans, which are more and more basically requiring folks to get into Medicare because they'll have language in their plan documents that say, look, you technically do not need to enroll in Medicare. However, we, the health insurance company, will only pay what Medicare would have paid for a procedure. So what that can mean is that you'd be on the hook for the remaining amount, which can be substantial. And you also want to make sure that you're being aware of private contracts that you might sign with a provider. Um, and kind of on top of that, FEHB's drug coverage is very comprehensive. So when we're talking about like Part A and Part B together as original Medicare, you know, one of the big reasons why people elect it in retirement is that it really reduces their annual deductibles, co-payments, co-insurance. If you're enrolled in FEHB and in Medicare, you're really, really reducing your out of pocket. That's usually why people do it. So let's take an example that happens actually a lot to folks that we work with when they're thinking about if they should get Medicare or not. And it's something like, let's say, suppose I'm going to have to get a knee replacement, or I'm sorry, a hip replacement. So I'm enrolled in Medicare's Part A and Part B, and I'm also enrolled in FEHB. Okay, so I'm paying my Blue Cross premiums, which are $289 a month. In retirement, everything's a monthly number. But then I'm also going to keep my Medicare Part B. Or I'm not going to keep it, I'm going to enroll in it. That's going to cost me $206 a month. However, a lot of the health insurance plans, a lot of the FEHB plans will actually reimburse you for a portion of the Medicare Part B premiums that you're paying. So in Blue Cross's case, on the basic plan, they'll actually reimburse you for a portion of it. So your net premiums for that year are just over $5,000. Let's say that hip replacement costs $40,000. Well, Medicare picks up 80% of the costs of whatever the care is. That's how it works. That's why people use Medicare plus a supplemental because Medicare is going to pick up 80%, so they'll pick up the 32,000. Then Blue Cross will pick up the rest. So that's the extra 8,000. And so your required extra to be paid out as an enrollee is $0. So your total healthcare expenditures for the year are just over $5,100. But that's all premium. And that's something that you'll basically know in advance, right? You would know that on January 1st. If you only enrolled in FEHB, you're only going to pay premiums for FEHB. So you're going to notice that your premiums lower, right? You've only got that premium. There's no Medicare Part B because you're not enrolled in it. However, Blue Cross says they will only pay what Medicare would have paid. So Blue Cross will pay 32,000, but that means that you as the enrollee will have to pay either the difference or up to your out-of-pocket max, whichever is lower. So in this case, let's just use this example, you've got to pay $7,500 to get to your out-of-pocket max. So your total health care expenditures for the year, premium plus paid out for your portion of the hip replacement is almost $11,000. So when people are thinking about taking Part A and Part B, or whether they're not and just going to stay on FEHB, if they're worried about that high out of pocket, or if they really like that certainty of knowing, hey, look, I got my Medicare Part B premium, I've got my FEHB premium, and that's all I'm going to have to pay, and I can kind of plan around that and build it into my monthly budget. Um, that's why people tend to elect Part A and Part B with FEHB. And I will say that maybe 5, 10 years ago, um, there were a lot of federal employees who just stayed on FEHB. But the plans have changed. They're definitely pushing more people onto Medicare. And so the vast majority of folks that we work with are enrolled in both. And if Medicare changes, if FEHB changes, the health insurance industry was very different 15 years ago. Like the whole market was very different. And I would expect 15 years from now, it'll be very different. So these things are dynamic. They're also very prone to legislation. So all that's to say, like it could change in the future, but this is how things tend to work right now. So we also want to go through a couple FAQs, some frequently asked questions that we have that, you know, a lot of folks, especially when we're helping them do retirement planning, ask us a lot of questions about FEHB. Some of the most common are, can I change my plans after retirement? Yes, you can. So you can change your FEHB plan during open season, even in retirement. So perfect example of that. Let's say that you live in California and you're enrolled in a Kaiser plan. And then you relocate down to Florida and maybe Kaiser's not as strong there and you want to go into Blue Cross Blue Shield and you've been retired for 3 years. Well, you can, during open enrollment, pick a different FEHB plan offered by a different provider that fits well with where you are, where you live. So that's a really, really powerful bit of optionality that you have. Um, as a federal retiree. Like a lot of people are very, very envious of that. Then some folks ask, hey, can my spouse stay on my FEHB in retirement? The answer to that is yes. So long as you have access to FEHB, your spouse can access FEHB too. So those are two of the big questions that people have when it comes to FEHB planning and retirement. So we've gone through an awful lot today, and I'm going to open this up to questions because I know that a lot of you probably have many, and Lauren and I will be able to answer them. But then also a great way to get started is to visit our platform. Go to goparco.com. You can scan this QR code. You can set an appointment, and we'll go through everything we've talked about today on the federal healthcare side, but then also a whole lot more and how it applies to your specific situation. So we haven't done a detailed FEHB and Medicare presentation in a while. So I'm looking forward to getting your feedback and your questions. I already know we're going to be doing an encore of this presentation next week. So if there are other questions that you have or things that we haven't covered tonight, please ask them here so we can iterate on that for our presentation next week too. As always, it's a pleasure to present to you all. Sorry about the audio issues a little bit earlier. And I'm looking forward to answering any questions that you have in the chat window or the Q&A window. All right, so that's an interesting question. For someone who is under 65 and retired, takes another job that provides health insurance, how does FEHB interact as secondary insurance? It, I think it interacts pretty well. Generally what we recommend though for folks, especially if you're thinking about getting another job somewhere after retirement, is talking to your um, new employer and saying, hey, look, I'm already getting health insurance from my other job or I got to keep it. So can you pay me more? Now, obviously, if the other job's giving you like crazy good benefits, maybe that's not an option, but that's worth a conversation. We've heard a lot of folks say that they've talked to the place that they're working with and they actually just got paid more to do so. This is a really, really good question. And Faye, I hope that was helpful to you. Are my premiums being paid during the government shutdown? Will it be covered if I go to a doctor? The answer to that, Tammy, is yes. Yes. Um, the premiums are being paid during government shutdown. Everything gets like back paid. You do not lose coverage because of a government shutdown. Another question. If you change your FEHB plan during open season, when will the change take effect? Say if we do so during this open season. So if you change your plan during this open season, I believe that becomes effective the beginning of February. And Lauren, you could message me and or answer that, but I believe it becomes effective the beginning of February. It's either the beginning of February or beginning of January. Da, 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 da. John asks, I'm CSRS retirement, but I work for a state and don't have FEGLI. Can I pick up FEGLI in retirement? John, do you mean FEGLI or do you mean FEHB like we're talking about today? Um, that will help me answer that question. Um, other John asks FEHB. So you can't pick up FEHB in retirement. Um, but if you work for the state, we should talk one on one because oftentimes, depending on the state that you work with, the states follow the same rules as the feds. So usually you can keep that with you in retirement. But we can chat or go through your situation there and check what the rules are for the state government that you work for. Da, 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 da. John asked, with the big rise in premiums for 2026, any recommendations on FEH plans that are more economical but comprehensive in coverage? So I would say for that one, what has become more and more common for us is to see a lot of Blue Cross Blue Shield Basic. I think people like that network, and they get a lot of coverage for the money. If you're more sensitive to premiums than that, there are like some consumer-driven options. Um, but it can depend on what healthcare needs you have. Uh, that's a really, really good question. Is there a good website to compare the different healthcare plans? Is there one that takes into account your location? Yes. So, Angie, there is a website. It's on OPM. Lauren, if you will uh, send a message in the chat window of a link to the OPM FEHB plan comparison tool, just so folks can access that, I think that'd be really great. Um, Angie, that'll be right within the chat window here in just a minute. Uh, just got confirmation those premium or your plan changes take effect in 2020 or in February of 2026. So if you change during open season, they take effect in February. So another question around choosing Part B for high earners with IRMA. So if you're a high earner, you can be exposed to this extra Medicare tax called IRMA. We didn't cover it in tonight's presentation. It's probably something we should add um, to make our Medicare section more beefed out. And to be honest with you about the IRMA stuff, um, I would say it really depends on how long you expect the IRMA to last. So there have been a few folks where, let's say we're doing Roth conversions for them, where they're converting portions of their traditional TSP or traditional IRA into Roth. And so they, for a period of time, have high income, right? Because they're realizing a lot of that during those conversions. We just kind of say, look, that IRMA is kind of like part of the cost of doing the conversion. And once you do those Roth conversions, that IRMA will go away because you're going to be you're just having like super normal income, increase in income for a period of time as part of your financial planning. There's not really any other way to avoid the IRMA. Um, if you don't enroll in Medicare Part B, you can delay it, but every year that you delay it, the premiums go up by 10%. So they basically penalize you for waiting. Um, so that's usually the strategy we help clients strategize or think about. It's focus first, like what's the goal? If the reason why you're exposed to IRMA because you're doing a lot of Roth conversions, we say, well, look, just you're just gonna have to eat it. If there's something else that we can plan around, we'll try to. But given how it's evaluated based on MAGI or modified gross adjusted gross income, it's very difficult to avoid. Um, I'm not 65 until next year. Will FEHB convert to supplemental mid-year? So that's a great question. You have I believe it's Lauren 8 months to enroll in Medicare after you turn 65. Um, so once you enroll, yeah, they sort that out, Julia. And Lauren just sent the link to this healthcare plan cost. I'm actually maybe we can tag or let's just make sure that Angie gets a link to that plan compare tool, Lauren. John asked another question. How about recommendations on dental and vision plans? I don't have any specific recommendations on it. I know a lot of folks enroll in the federal dental and vision plans. If you need it, I think those plans are relatively affordable compared to what's on the private market. Um, that's my if you need glasses and things like that, the vision plans can be helpful. I think most people, private sector or government sector, feel dissatisfied with dental coverage. I know most of my team does. Um, I think it's just kind of the nature of that insurance, but if you need it because you have a dental issue, you're glad you have it. So Gary asks, if you retired and didn't enroll in Part B, but would now like to, would you have to pay the enrollment penalty? So it would just depend on how old you are and how long ago you retired to figure out whether or not that 10% penalty would apply to you, Mr. Gary. Valerie asks, is there a number of years I must have FEHB in order to keep it in retirement? Does it depend on my age? So you need to be enrolled in FEHB for 5 straight years before you retire to keep it in retirement. Um, that's called the FEHB 5-year rule. All right, next, if my spouse turns 65 in 2026, but I do not turn 65 until 2027, should my spouse sign up for Medicare Part A and B in 2025? And you're enrolled in the HDHP plan. We would recommend that your spouse do enroll in that Medicare Part B when they become eligible. Though in your case, to be honest with you, like especially with that 8 month rule, you have 8 months to pick it up once you become eligible. You could wait, Jay, until you both become eligible because it's within that 8 month window, and then you could both enroll at the same time. And I would say that next year, when you guys are doing your planning during next year's open season, I would do that planning expecting to be enrolled in Medicare. So picking a plan that plays well or plays nice with Medicare. I hope you're all finding these answers helpful, and we're going to be adding a lot of these to the FAQs for the next one, so keep them coming. All right, let's see. Next question here. So I received a letter about opting out of being enrolled in FEP Medicare drug prescription program. Depending on my income, I could have to pay a monthly Part D premium. Prescription drug plan with a Medicare contract. Should I opt out and stick with the FEP drug plan? Thanks. So I would have to kind of see the details of it because sometimes like the wording on these things, it obviously matters. But all the federal healthcare plans have to support Medicare Part D drug coverage or have to have like have to offer basically like the same coverage. So you don't necessarily have to enroll in Medicare Part D. So Judy, if you'd like, you can set up a time to talk to one of us here and we'll go through that with you. But generally most federal workers don't have to enroll in that Part D. Great question. So there's another question. I'm a veteran. I have TRICARE for life. Do I still need to enroll in FEHB and Medicare? So there's there's a couple answers to that question. For veterans who are on TRICARE for life, who are also enrolled in FEHB right now while they're working, first thing we recommend they do is that upon retirement, do what's called an FEHB suspension. This allows you to preserve your access to FEHB in the future without having to continue paying premiums every year. So if something changes with TRICARE, if Congress changes something with TRICARE, or they change something with FEHB and you want to opt into it for whatever reason, it always leaves that door open for you. But as I recall, and Lauren, you could correct me if I'm wrong here, for veterans who are on TRICARE for life, they're required to enroll in Medicare when they turn 65 or retire, whichever happens later. Um, I I'm very sure about that, but we'll get confirmation here in the chat window in just a second. Another question: is it worth it to buy Medicare Part B? I have a high adjusted gross income. Um, so it would just depend on Naresh, if you're still working or not. Um, if you're still working for the government, um, or if you're still working in general, you fall under what's called a large employer group waiver, so you don't have to enroll in that until you're retired. Um, if you expect your income to change a lot, then that would mean that maybe it'd be worth it to enroll in Medicare Part B. But I wouldn't necessarily do it until you retire. So if we got a little bit more details about you, that would be helpful. Um, you're retiring in December. So then if you're retiring in December, I'd have to look at what your income will look like in retirement from your pension, social security, all those things. But I would hypothesize that it would make sense for you to enroll in Medicare within 8 months of retiring. That would be based on the information I'm seeing here, I'd say yes. I'd say yes. Yeah. So the TRICARE question, you do have to enroll in Medicare's Part A and B once you become eligible or retire, or once you retire or you're 65, whichever happens later. hopefully you're all finding this helpful. We know there's a lot of permutations when it comes to FEHB and um, Medicare and all this stuff. And we know it's always constantly changing. Okay, so I'll answer these in order here. This recording will be made available on our YouTube channel probably sometime tomorrow. Um, so yes, and Naresh, if you send us an email, we'll send you a link to that as soon as it gets uploaded. If you turn 65 mid-year, does when does the rebate for FEHB kick in? As I recall from reading the plan documents, the rebate kicks in once you enroll in Medicare. So if you enroll in Medicare when you turn 65 and those premiums start, it will kick in then and they'll prorate it for the number of months that you were covered. Um, and they'll send you a check. Um, June asks, how do they calculate IRMA if you file joint with a spouse and the spouse is not on Medicare, but you are? There's a household IRMA as well. Um, there's a household IRMA as well. Um, and I think that's a good couple of slides we should add for our next presentation next week, just to kind of highlight the impact of IRMA for folks, Lauren, because we've been getting a bunch of questions about that. Well, you guys are all asking these questions, which is great. If there's other things that you say, hey, look, I wish you guys had covered X or Y or more stuff, keep like ask them here because we'll add the slides for it. So what is this 8 month sign up period for plan for Part B? Does it begin on the 65th year of birth month? So it starts when you turn 65 and says that you have 8 months after you turn 65 to enroll in Medicare Part B. So if you were born January 1st, you have until the beginning of August to enroll in Medicare Part B. This is an interesting question. I'll be enrolled in Medicare Part A and Part B next month. I also plan on keeping my PSHB, Postal Service Health Benefits, which is basically like the FEHB for postal folks. Should I also continue my separate federal employee, my FedVIP plans, since the PSHE plans working with Medicare are covering some dental vision? My answer to that would be I would talk to your dentist about whether or not the PSHB plus the Medicare that you have falls under their coverage. Um, and same thing for your optometrist. If the answer is yes, then hey, maybe you don't need the FedVip. If the answer is no and the premiums aren't too bad, maybe it's worth keeping the Fed. The 8 month sign up period does apply to those with TRICARE as well, as I recall. Or though maybe you could clarify on the Medicare for veterans and TRICARE um, with that question. That 8 month sign up grace period question I see in the Q&A, we're going to get an answer for you here in just a second. I want to make sure we have a really tight one. Tammy asks, do I enroll for Medicare through the Social Security website? I believe that's yes. Right, Lauren? You do it more with more folks than I do. You enroll through SSA, and I know it comes right out of your SSA check too, um, as well. So Susan asks, if you are still working, how long after you retire should you enroll in Medicare Part B? So you have up to 8 months after you retire to enroll in Part B. So let's say that you retire in March and you are 68 years old. You have until November to enroll in Medicare Part B. I hope that was a helpful answer, Susan. Jay, to your question, I would recommend um, there's no once you're eligible for Medicare Part A universally, you should sign up for it, no matter what. That's a no-brainer. It's free. There's no reason not to. There's no reason not to. And in your example, I would have your spouse wait till you turn 65 to enroll in that Part B, because then they can enroll with you together. So the process for suspending premiums, if you're military and you're on TRICARE and you're also enrolled in FEHB and you want to suspend your FEHB premiums, there's a specific FEHB suspension form that Tiffany, if you send us an email, we can email over to you and walk you through that process. Um, you basically fill out that FEHB suspension form saying, "Hey, I want to suspend my coverage," and then they'll suspend it for you. Um, Juan asked a kind of specific question about how he has standard Blue Cross Blue Shield. Um, Premiums are obviously getting higher, and is it a good option to enroll in something that's lower cost and still have the flexibility to go out of network? And can he carry over the FSA? I I can't recall. I don't think you can carry over flexible spending accounts. I think those expire every year. You have to spend that money every year. Um, but one, if you want, um, you could create an account on our site here, goparco.com, and schedule an appointment with us, and we'll book a time to go through that with you one on one, in addition to everything else, because we know these things are complicated. It can depend on where you live, the health of your family, all those different permutations. All right. Well, I don't see any more questions. I know this is a big, big, big topic. So um, we couldn't have covered everything tonight, even if we had really wanted to. Um, you can keep that J while you're on Part A and Part B in 2027. Yes, you can keep that. Um, but next week we'll be kind of rerunning this, incorporating a lot of your feedback and questions to make the presentation even better and more thoughtful. Um, but just believe us that we know how much more expensive these plans are getting. We know it's becoming a bigger and bigger portion of everybody's budget, and making the best decision for you and your family is obviously what everybody wants. And so we think that having the knowledge and certainly having the ability to read through these documents and being able to interpret them is at least a really important step into making that right decision. So with that, we'll go ahead and let you all go. As always, it's a pleasure to present to you all. And if you need anything from us, please let us know. But if not, we'll see you all next week.